You see a pimple. You know you shouldn't. You squeeze it anyway. Then you look in the mirror, and there it is, red, inflamed, clearly worse. Sound familiar? Today, as a dermatologist, I'll explain exactly what happens to skin, layer by layer, at the moment of squeezing, by cell response, why it always makes things worse, and what can be done instead right now to make the pimple go away faster, not leave a mark for several weeks. Let me start with an honest moment. Squeezing pimples is not simply a bad habit. This is very common behavior with a strong psychological component. Studies show that about 80% of people with acne regularly squeeze pimples, despite knowing you shouldn't. Why is it so hard to stop? Because squeezing gives an immediate feeling of control and completion. There's a pimple. You did something with it, as if you solved the problem. The brain receives short-term reward, long-term consequences. Red mark, enlarged pore, scar risk come later. This is a classic trap of immediate reward versus delayed consequences. Let me describe a situation most people will recognize. Evening before an important event, a meeting, interview, date, you notice a pimple. Red, noticeable, painful. Logic: need to remove this. You start squeezing. First few attempts? Nothing, just painful. But you continue. Finally, something comes out. You look, and there's already not one neat pimple, but a large, red, inflamed spot, sometimes with blood. Next day, worse than yesterday. Or another scenario, a small white pimple almost invisible, but you feel it with your finger. Couldn't resist, squeezed it. Nothing particular was inside, but now there's inflammation at that spot where there wasn't any. Skin responded to the mechanical impact. And there's a third scenario, when squeezing became a ritual. Every morning at the mirror, examination, discovery, attempt to squeeze. Sometimes squeezing something that wasn't ready yet. Inflammation. Not from bacteria, but from pressure. Hands become a source of new breakouts. And here's what's telling. In people with this ritual, breakouts often concentrate in the places most convenient to touch. Cheeks, chin. Not because there are more sebaceous glands there, but because hands are applied there more often. This is an important diagnostic clue. If breakouts are located exactly where you usually touch, try a month without touching and see the dynamics. What unites all three stories? The person is trying to help and makes things worse. Not because of carelessness or aggressiveness, but because the squeezing process itself by its nature creates damage that wasn't there. Regardless of how carefully it's done, there's an important clarification to make right away. Chronic compulsive skin picking, dermatillomania, is a real condition that benefits from professional support, not only dermatological. Now, the mechanism. I'll explain as a dermatologist what exactly happens layer by layer. Let me start with what a pimple is before squeezing, because this is important for understanding what happens during. A pimple is an inflamed hair follicle. Inside the follicle, a blockage of skin sebum and keratinized cells, in which Cutibacterium acnes multiplies. Immune cells respond to its metabolic products with inflammation. A pimple visible on the surface. This is already the final stage of this process. Before it became noticeable from outside, inside the follicle inflammation had already been proceeding for several days. That's exactly why the attempt to remove an already visible pimple is often unsuccessful. You're trying to intervene in a process already running at full speed. Around the follicle, edema, redness, neutrophil accumulation. A pimple is an isolated inflammation focus. The key word? Isolated. First mechanism. Mechanical spread of contents inward. When you press on a pimple from outside, pressure inside the follicle sharply rises. Its wall, already weakened by inflammation, doesn't always withstand this pressure from outside. Part of the contents, bacteria, skin sebum, cell fragments, breaks not outward through the pore opening but inward, into the dermis. Exactly where blood vessels are and many immune cells are located. That's exactly why, after squeezing a large, painful node, often appears where a small surface pimple was. Inflammation went deeper. There it proceeds longer, more painfully, and leaves more significant traces. Important detail. External pressure doesn't always fully extract the contents through the pore opening. Often it ruptures it in several places simultaneously. One part comes out, another goes inward. You see, something came out, and perceive this as success. But under the skin at this moment, a new inflammatory response is already proceeding to what went down. Second mechanism, expansion of inflammation zone. With squeezing, you mechanically damage surrounding tissues. Capillaries are injured, hence bloody contents. The follicle wall is damaged, and contents flow into surrounding dermis. Neighboring immune cells respond with a new inflammatory reaction. The area of redness and edema expands. It covers already not one follicle, but several. This explains why after squeezing the red spot is always larger than the pimple was. You didn't remove inflammation. You spread it by area. Third mechanism, introducing bacteria from skin and hand surface. On skin and hand surfaces, there's a microbiome, a huge number of bacteria, most of which are harmless while they're outside. With squeezing, an open wound forms in the epidermis, a micro-injury through which surface bacteria can penetrate into the dermis. This is especially relevant if hands aren't washed. But even with washed hands, mechanical damage itself opens a path for external flora. There's another bacteria source rarely thought about. Under nails, even after washing hands, subungual flora is preserved. Exactly, it becomes the cause of secondary bacterial infections after squeezing. This isn't a reason to wash hands especially thoroughly. It's a reason not to touch the face at all. Fourth mechanism, melanocyte activation and post-inflammatory hyperpigmentation. Here's why dark spots remain after squeezing that don't go away for weeks. Melanocytes, cells producing melanin, are activated by inflammation. With mechanical damage, inflammation is more intense. Accordingly, more intense melanocyte stimulation. More melanin is deposited in surface skin layers. This is post-inflammatory hyperpigmentation, the dark spot at the pimple site. In people with darker skin, this effect is more pronounced. In people after 35, skin renews more slowly. Spots last longer. But the mechanism is the same in everyone. Mechanical damage provokes a stronger pigment reaction than the pimple itself without intervention. Fifth mechanism, scarring risk. A pimple that passed on its own practically leaves no scars with a normal immune response. Scars and acne in most cases, consequences of either very deep inflammation or mechanical damage. Squeezing creates exactly that additional damage. With content breakthrough into the dermis, fibroblasts respond with collagen synthesis. And if this happens chaotically, scar tissue forms at the inflammation site. Atrophic scars after acne, pits on skin, are the result of exactly this disordered collagen formation with deep inflammation. This is important to understand. Scars are almost impossible to fully remove after they've formed. Laser, peels, microneedling, all this improves but doesn't fully eliminate. Whereas preventing a scar is significantly simpler than removing one. Every time you don't squeeze a deep inflammatory element, you reduce the risk of a scar that will remain for years. Sixth mechanism, psychological reinforcement of the cycle. This is no longer about skin, about behavior. Squeezing relieves anxiety in the moment. This behavior is reinforced by immediate effect, the feeling of completion. Therefore, it repeats. Meanwhile, long-term consequences, more breakouts, marks, traumatized skin, cause anxiety again. Anxiety again provokes the desire to do something with pimples. The loop closes. That's exactly why simply knowing "mustn't squeeze" is insufficient. An alternative strategy is needed with a concrete action that also gives a feeling of control. Now about mistakes. The most typical actions with pimples that make things worse. Mistake 1. Squeeze an unripe pimple. A pimple located deep in tissue without a visible head. This isn't an inflammation element ready to exit. Pressure on it doesn't extract contents. It pushes them deeper. This is a guaranteed way to get a deep, painful node instead of a small surface inflammation. Rule: if there's no white or yellow head, the pimple isn't ready. Any pressure on it, exclusively damage. Mistake 2. Use nails. Sharp nail edges cut the skin surface, creating not one injury but several. Risk of introducing bacteria from under the nail into the wound is many times higher than with fingers. Nail marks heal for a long time and often leave linear microscars. If something is to be done with a pimple, only with pads of clean fingers. Though better, nothing. Mistake 3. Wash aggressively after squeezing. Need to disinfect. The intuition is understandable, but the result is opposite. Aggressive washing with soap, alcohol, toner after squeezing destroys what remained of the skin barrier. The open injury becomes even more vulnerable. Correctly, gentle washing without friction, then point-wise antibacterial product on the wound. Separately about ice. Some advise applying ice to an inflamed pimple. This works. Cold reduces edema and somewhat calms inflammation, but only if ice is wrapped in cloth to avoid direct skin contact, and only for a short time. This is a good emergency measure exactly instead of squeezing. Mistake 4. Apply heavy foundation on top. This is an almost reflex reaction. Hide the redness. But heavy coverage on an open injury creates an anaerobic environment, without oxygen, exactly the one Cutibacterium acnes thrives in. Healing is delayed. New inflammation in the same spot, very likely. If masking is needed, light, non-comedogenic product minimally and only after the surface layer has healed. Mistake 5. Touch the same spot several times a day. Check if it got better. See if a head appeared. Each touch, mechanical irritation, warmth from fingers, potential bacteria introduction. Skin can't normally heal while being constantly touched. One of the most effective principles when working with pimples: minimize tactile face contact in general. Mistake 6. Wait until it passes on its own, while continuing to squeeze. This isn't a contradiction. This describes what actually happens with most people. They know it needs to be left alone but continue touching. On its own doesn't pass, because on its own doesn't presuppose daily mechanical intervention. A pimple passes on its own when genuinely left alone, and an antibacterial and anti-inflammatory environment is maintained from outside. Self-healing timeframe for a normal inflammatory pimple: 7 to 10 days without intervention. With correct point-wise care, 5 to 7 days. With regular squeezing, 2 to 3 weeks, plus risk of a spot for several more weeks after. The math is unambiguous. You have a choice between 5 to 7 days or 2 to 3 weeks plus scar risk. Every time a hand reaches toward the face, you can recall this difference. Now, what actually works instead of squeezing? An approach that gives a feeling of control, because you're genuinely doing something, and at the same time doesn't damage skin. First, understand that you can accelerate but can't force. A pimple passes in a certain time. Squeezing doesn't shorten this time, it lengthens it, adding damage and scar risk. Accelerating ripening and inflammation resolution is possible with the right external products, but not mechanical pressure. This is a mindset change. Not remove immediately, but help pass faster without consequences. Second, point-wise antibacterial influence. If you really want to do something with a specific pimple, it should be applying an antibacterial product point-wise. Not cream on the whole face, but exactly point-wise on the inflamed element. An antibacterial substance works against Cutibacterium acnes in the follicle. It doesn't squeeze out. It suppresses bacterial growth, reduces inflammatory response. This accelerates resolution without creating additional damage. Here, tea tree oil is relevant. Its active component, terpinin 4-ol, has proven antibacterial action specifically against Cutibacterium acnes. With point-wise application, it works as a local antibacterial agent, reducing bacterial load in the pore. More about this in the product section. Third, cold compress with acute inflammation. With a large painful node, deep inflammation, cold reduces edema and decreases painfulness. Clean cloth or gauze moistened with cold water for a few minutes. This isn't treatment, it's reduction of the acuteness of the inflammatory reaction. Especially relevant right after you already squeeze something and want to minimize damage. Fourth, minimal face-touching regime. This sounds simple but requires mindfulness. Don't touch face with hands during the day. Change pillowcase more often, once every 3 to 4 days, because skin sebum, bacteria, and care product particles accumulate on it. Don't press the phone against the cheek. Phone screen is one of the most bacterially loaded surfaces in regular contact with facial skin. Fifth, correct care reducing probability of new breakouts. Gentle washing without aggressive components. Light, non-comedogenic moisturizing cream. Dehydrated skin compensates with intensified sebum production. Regular use of antibacterial and anti-inflammatory actives, azelaic acid, niacinamide, tea tree oil in appropriate concentration. Not for point-wise elimination, but as supporting care reducing background inflammation and bacterial load. Sixth, replace squeezing ritual with care ritual. This is a psychologically important point. The need to do something with a pimple is real. It can't simply be canceled by willpower. It needs to be redirected. The ritual of evening washing with applying a point-wise product gives the same feeling of action and control, and at the same time doesn't damage skin. The mirror in the evening isn't for squeezing, but for applying a product. This is a specific behavioral replacement that really works with regular use. Another practical tool. If you notice a hand reaching toward your face, try replacing this action with something else involving hands. Clench your fists for a second. Rub your fingertips. This sounds unserious, but works as a behavioral pattern break. The brain receives a motor signal. The urge to touch the face momentarily decreases. This moment is often enough to switch. Now specifically, about tea tree oil. I'll explain as a dermatologist what this is, why it works, and how to use it correctly. Tea tree oil, Melaleuca alternifolia, is an essential oil from the leaves of the Australian tea tree. It's been used in dermatology for over 100 years, and over this time, quite serious evidence for use in acne has accumulated. Main active component, terpinin 4-all. Exactly, it provides antibacterial action. Mechanism. Terpinin 4-all disrupts the integrity of Cutibacterium acnes and other bacteria cell membranes present on skin with acne. The bacterium cannot adapt to such influence. Resistance to tea tree oil, unlike antibiotics, doesn't form. Beyond antibacterial action, anti-inflammatory effect. It reduces pro-inflammatory cytokine activity in skin. This means it works at 2 levels simultaneously, suppresses bacteria, the inflammation cause, and reduces the inflammation itself. Clinical studies. According to comparative studies data, a 5% tea tree oil solution with point-wise acne application gave results comparable to benzoyl peroxide for reducing breakout count, with significantly fewer side effects. In one such study, participants using tea tree oil 4 times less often reported dryness and flaking compared to the benzoyl peroxide group. Now about an important application moment that can't be skipped. 100% essential tea tree oil. This is a concentrated product. Applying it undiluted directly to skin is not allowed. This will cause irritation, chemical burn, and make things worse. The effect will be opposite to desired. How to use correctly. Dilute in a carrier oil. Jojoba oil, rosehip oil, plain water or aloe vera gel work as a carrier. The required working concentration, about 5%. This is 1 to 2 drops of essential oil per teaspoon of carrier oil or gel. Apply the resulting mixture point-wise, with a cotton swab or fingertip, only on the inflamed element. Before first use, a patch test on a small skin area. Apply to the inner forearm or behind the ear. Wait 24 hours. Make sure there's no allergic reaction. Important note about face application. Tea tree oil should not be applied near the eyes and on mucous membranes. If it gets into eyes, rinse with water. During pregnancy, consult a doctor before using any essential oils. These are standard precautions for this product category, but better to say it directly. Additionally, tea tree oil shouldn't be combined with other active anti-acne products on the same area at the same time. For example, with benzoyl peroxide or high-concentration acids. This can cause irritation. Point-wise application means exactly point-wise, only on the inflamed element, not around it. When to apply? At the moment when you want to squeeze. This is a direct replacement of a destructive action with a productive one. In the evening before sleep, after washing. In the morning under daytime care if there's no sunscreen, which can reduce effectiveness. What to expect? Tea tree oil doesn't eliminate a pimple in an hour. It accelerates its resolution, reduces inflammation and bacterial load. Typically, within 1 to 2 days of point-wise application, the inflamed element becomes noticeably smaller, less painful, and more quickly transitions to a healing stage. Now Foods Tea Tree Essential Oil. 1 fluid ounce, 30 milliliters. 100% pure natural essential oil, without additives and diluents. This means, before use, dilute yourself in ratio 1:9 with carrier oil. Why this is more important than it seems. 100%. This is a guarantee that you're getting exactly terpinin 4-all at the needed concentration, not a diluted product with unpredictable content. With this exactly, that's why it requires dilution. Concentration is so high that undiluted application will cause chemical irritation. This isn't a defect. This is a property of a concentrated product. Who is this especially relevant for? Everyone who has a habit of squeezing pimples and wants an alternative nearby with a concrete action. Those looking for an antibacterial product without strong drying effect. People with sensitive skin who tolerate aggressive drying products with high alcohol or benzoyl peroxide content poorly. Link to tea tree oil. In the description of this video, hherb.com/pr/now-foods-oils-tea-tree-1-FL-OZ-30-ML/37827. Right now, if you're at the mirror and there's a pimple, don't squeeze. Take a cotton swab, a drop of tea tree oil diluted in any carrier oil 1 to 20, and apply point-wise. This takes 30 seconds. This creates the same feeling of action. And this works in favor of skin, not against it. Remember the main thing from today's conversation. A pimple is an isolated inflammatory focus. Squeezing turns isolated into widespread. Any antibacterial and anti-inflammatory product from outside supports the natural healing process. Mechanical pressure interrupts it and creates new injuries. Stopping is difficult. This isn't a knowledge question. It's a habit and behavioral pattern question. But every time you choose oil instead of squeezing, skin heals faster, fewer marks remain, and the next pimple appears less frequently. This accumulates.